revision of the ICD came into use in World Health Organization member states beginning in 1994. The United States is one of a handful of WHO member countries that has not already fully implemented ICD-10. The ICD-10-CM code set provides improved granularity of the codes. This means that the documentation you provide will be almost directly translated into these codes, allowing much greater levels of detail, including anatomy and pathophysiology for a particular patient. As you will see, this has been achieved by extending the codes from a maximum of 5 characters, as in ICD-9-CM, to a maximum of 7 characters.
Hello, my name is Dr. Ricardo Martinez, and I work on the ICD-10 transition with Centers for Medicare and Medicaid Services, or CMS. As a practicing physician, I look forward to the innovations that ICD-10 will bring. With the October 1st, 2015 transition deadline fast approaching, now is the time to get ready. And as you've probably noticed, there's a lot of information out there about ICD-10, so to help you sift through everything, I want to share a few key points. First, I want you to know that it is time to transition to ICD-10. ICD-10 is foundational to modernizing healthcare. It serves as a building block that allows for greater specificity and standardized data. This detail and standardized data will in turn help accountable care organizations demonstrate quality of patient care. ICD-10 improves data to better document patient complexity and acuity of care. This documentation can support reimbursement for the care provided. By using ICD-10's specificity to improve quality measurement and reporting, we can strengthen patient care outcomes. With ICD-10, we can realize the full potential of CMS electronic health records and quality reporting initiatives. These have sometimes been called competing initiatives, but they are in very fact much aligned with ICD-10. They were built on specificity and standardized data that ICD-10 offers. The next thing I want you to know is you don't have to use all 68,000 codes. Keep in mind, though, that your practice does not use all 13,000 codes in ICD-9, and you don't need to use the 68,000 codes that ICD-10 offers. As you do now, your practice will use a very small subset of all the codes, and you'll use the same process to look up ICD-10 codes as you will for ICD-9 codes now. Increasing the number of codes does not make ICD-10 harder to use. As with ICD-9, an alphabetic index and electronic tools are available to help you with code selection.
Using ICD-10, doctors will capture much more information, meaning they can better understand important details about a patient's health than with ICD-9. The new codes reflect how healthcare has changed over the past 30 years, with many advances in clinical practice. You'll notice updates, including definition changes, terminology changes, and a lot more specifics. The most obvious change is that the code structure has expanded. While the old codes have 3 to 5 characters, the new codes have up to 7, allowing for more detailed descriptions. The first 3 characters represent the category of disease or health condition, followed by a decimal point. The 4th, 5th, and 6th characters represent clinical details, such as the cause of the disease, its severity, and its anatomical location. Let's look at how this all works, using the example of diabetes. ICD-9 has 2 major categories of diabetes codes, diabetes and secondary diabetes. But ICD-10 separates type 1 diabetes from type 2 diabetes. ICD-10 also eliminates the broad category of secondary diabetes, instead offering secondary options, such as underlying conditions or causes. To capture more details, subcategories can be added to represent both complications and affected body systems. For example, the diabetes subcategories include ketoacidosis, kidney complications, ophthalmic complications, neurological complications, and circulatory complications. Let's say a patient has diabetes due to an underlying condition. That's code E08, followed by a decimal point. Next come the details in the form of subcategories, starting with the 4th digit. Ketoacidosis, for example, has a 4th digit of 1. To add even more detail, a 5th digit of 0 is ketoacidosis without coma, and a 5th digit of 1 is ketoacidosis with coma. These subcategories stay the same, no matter what type of diabetes is being described. For example, diagnosis code 621 describes the complication of foot ulcer. So E10.621 is type 1 diabetes with foot ulcer, and E11.621 is type 2 diabetes with foot ulcer. In this example, the provider has documented the category of diabetes and the complications. Use additional separate codes for treatment with insulin and to describe the site of the ulcer, and the coding is complete. ICD-10 allows providers to capture more detailed information about their patients. This, in turn, leads to a more detailed patient history.
ICD-10 fits into the larger picture of eHealth: improved clinical data, capture and sharing, improved quality of patient care, and more detailed public health information. But the clock is ticking. So take action today to prepare your practice for tomorrow by using the tools, training, and resources discussed in this presentation to help you through the transition.